Now, as y'all have been talking about this, it came to mind that I get a lot of phone calls from members that are not as familiar with the trajectory of TRS-Care and how this crisis came to be. What can they say to their legislator about this crisis and how it occurred? And how can they understand it from their perspective? Why is TRS-Care in the situation that it is in today?
Well, it's a great question, and I'm going to throw this back to Ronnie in just a minute. But the general overview that I have is that we knew this moment would come. I don't know that anybody could say it's because of what's been going on at the federal level with the Affordable Care Act. That there doesn't seem to be one singular issue that the nation may be focused on right now that has created this this moment in time for TRS-Care. We have various funding sources that we utilize to pay for the cost of TRS health insurance, and those funding sources simply have not been able to keep up with the cost of the program. We've had more retirees. We've got folks that are living longer, thank goodness, that we have the quality of life that we do under TRS. And those funding sources, in a lot of ways, are based on how much money active teachers are getting paid. Bill and I sometimes go out and joke with our local members and say that if the legislature would just give all of our active teachers a 50% raise, I don't know if we would have this problem with health insurance. We'd have a lot more money coming in for TRS-Care. I don't know that that's going to be realistic. So we're gonna have to work on some solutions that may talk about increasing those funding sources. But Ronnie, what have I missed, or what do you think else?
Well, I think the real problem is, as you mentioned, we have more and more retirees, and healthcare costs are going up. And the average age of our retiree population is around 70. So prescription drug costs, for example, are going up. So the problem we have is that the funding structure, which is a percentage of payroll, isn't tied to the fact that we have more retirees and more healthcare costs. So somebody has to pay them. TRS has really done a good job of trying to control the costs. They've done Medicare Advantages. They bid out the prescription drug. But the bottom line is, to have quality health care, somebody has to pay for it. And because of the fact that we had built up $800 million a few years ago, the legislature actually reduced funding one year by just from 1% to 0.5%. But the bottom line is we're eating up all that balance. And when you run out of money, then it costs a lot more. So we just kicked the can down the road in dealing with this problem. And we tried to address it last session, but it became clear during the session that we could only deal with pension funds. And knowing with the new accounting rules, we're glad we did, because we fixed it. And so now it's time to deal with healthcare. So the fact that 10 years ago we knew it was going to be a problem, we've extended it 12 to 14 years is great, but we still have to deal with the underlying problem that there's more and more retirees and somebody has to pay. And so that's where our funding structure, I think, has not been adequate. I think it's really small. If you look at what the state pays on average for a retiree, it's probably just a little over $100 a month, $120 a month. That doesn't go very far when you have more and more retirees, and the costs are significantly higher. So we need more funding for the program, the bottom line. And I think the state and the districts have got a bargain for the last 25 years with the low percentage, but now it's time to start paying a reasonable cost.
So when you talk about this funding structure, for somebody who may not be familiar with that terminology, what does that mean when they are taking a percentage of payroll? Can you explain that in some simple terms for our members?
Yes, the public school, just as a pension fund, is funded on a percentage of payroll. My daughter is a teacher. If she makes $40,000, the state would pay us 1% of that a year, so we would get $400 for that payroll. So when payroll goes up, it was flat one year. So the money we got the next year based on the 1% payroll was the same dollar amount when there was no payroll increase. But we had probably 5 to 10% more retirees and 5%. So the bottom line is a percentage of payroll works if you have payroll growing a lot, and it correlates with increased costs like the pension does, because pension benefits are tied to payroll. But healthcare costs are not tied to the payroll. So when payroll goes up 4 or 5%, but we have more increase in retirees than that, then who's going to pay for the increase in healthcare costs? So the percentage of payroll works for the pension fund, but not for healthcare.